Well, we have 121 beds. Our goal is to provide quality nursing care and do that in a compassionate, caring way. What we do is when the residents come in, we do a complete assessment, and from that we develop an individualized plan of care which allows us to be able to offer person-centered care to that resident that is specific to them. What we're going for now is if you're a person or your loved one is a person who doesn't eat breakfast until 10 o'clock in the morning, allow you to have your breakfast at 10 o'clock in the morning. If you don't like to take your bath until night versus a shower in the morning, allow you to do that. And it gives them more choices, which allows us to provide better quality care to the residents. You know, I can't tell you if your loved one has had a fall in the past that they're not going to have one in our facility, but what we do when they come in, we look at them, we assess the risk factors, and if they're at risk for falls, we go ahead and we put interventions in place to try to prevent that. We can't always prevent it, but what we can do is to try to keep them from being hurt when they do fall. A lot of people expect us to be able to keep them from falling. You know, if you can't keep them from falling at home, I probably can't keep that from happening here. But what I can do is be proactive toward that and not wait till they fall and do something, is to try to get some interventions in place before it happens to keep them from injuring themselves. We provide nursing staff to our residents 24 hours a day. We utilize CNAs, which are our nurse aides, CMAs, who are medication aides. We also use LPNs and RNs to do that. We are now able to provide RN coverage 24 hours a day on all rotations throughout the facility. We adjust our staffing based on our residents' needs. Depending on if you have a resident that is requiring more assistance, you may have more staff. That is how we make those adjustments. We're, always have sufficient staff to care for the residents and provide the care that they need based on the needs that they have. We provide medications to our residents as ordered by the physician. We use all the different routes. We have some residents who are able to take their medications, what we call PO, and that means put them in their mouth and swallow them. We administer medications to residents who have G-tubes, and that is a tube in their stomach that their medicine goes in. We do injections. We're able to do IV medications, either in a peripheral IV line or through a central line or a Mediport. We also provide wound care to the patients. We have 2 wound care certified nurses in our facility and have a really good program with that. And we really look closely at preventing any pressure ulcers from developing in our building. And if we do get a resident that has a pressure ulcer, we have a really good success rate of being able to heal those wounds. When most people hear the word restraint, they think of someone being tied to a bed or tied to a chair. We do not do that. When we do have to use a restraint, it is more used as an enabler, and by that I mean you may have a resident who is in a wheelchair that uses a seatbelt for positioning to keep them from heading out forward, and by having that seatbelt, they're able to propel themselves around in the wheelchair inside the facility independently. Whereas if they didn't have that seatbelt, they would not be able to do that. We utilize Mary walkers, which is kind of like a PVC type walker that allows a resident to walk. It has a seat that's attached to it, and when they get tired, they can sit down. And again, if that resident wasn't able to utilize that, she would be in a chair somewhere and not able to move freely throughout the facility. So when we do use restraints, we try to use them in a positive manner to help the resident be more independent. And a lot of times we have family members who request that we use a restraint, and sometimes it is just for their security to know that they're able to, move around the building freely and not have to be left sitting in a chair somewhere all the time.